Hi, Dr. Thukaram. Thanks for making some time for us this afternoon. Would you mind telling us a little bit about yourself, what you do here, and maybe how long you've been with the Children's Hospital at St. Francis?
Hi, Lauren. Thank you for having me. I have been with St. Francis Children's Hospital since 2009 as a pediatric intensivist. This was my first job that I took right after graduating from my pediatric critical care fellowship, and I've totally enjoyed working here. It's a unique facility with excellent collaboration with different specialists, and we provide great care to our community here at Northeastern Oklahoma. I'm the current medical director of the Pediatric ICU, and we take pride with the work we do here, with the excellent work we do in collaborating with our multidisciplinary team to provide care for our critically ill children. In our pediatric ICU, we care for children with acute life-threatening illnesses to chronic medical illnesses. We have a 20-bed ICU. And in fact, we do have a 162-bed pediatric children's hospital with many specialized services that serve children ranging from infants all the way to adolescent age group. And when Children's Hospital really opened in 2008, we in fact added an additional floor that was included in the plan so that we could add beds and services in the future as community needs would arise. So truly, our hospital is staffed by board certified pediatricians and subspecialists, and we offer highest level of care for critically ill children in our pediatric ICU and the neonatal ICU. And we offer around the clock care by staffed exclusively by board certified pediatric intensivists and neonatologists.
You mentioned that we're the highest level PICU and NICU in town. Are there certain procedures or specialties that are only available at a PICU of our level?
Yes, absolutely. In our pediatric ICU, we have specialized nursing staff who collaborate with us to provide advanced modalities like extracorporeal membrane oxygenation for cardiopulmonary failure that is refractory to the conventional therapies. We do offer advanced modalities of mechanical ventilation like high frequency oscillatory ventilation. We offer certain nitric oxide therapy for pulmonary hypertension patients and for patients with refractory hypoxia. We also offer renal replacement therapy for our children with acute kidney failure. And this makes us unique in our town to help our patients and critically ill children in Northeastern Oklahoma.
So I know we also have the only pediatric emergency center in town, and other injuries may come into the PICU that you care for, as well as pediatric strokes. Is there any other information about those illnesses or injuries that you'd like to add?
Absolutely. We care for our traumatic brain injury patients. We have a unique pediatric stroke program. We participate in national organizations to benchmark our performance. We participate in improving pediatric sepsis outcome. We do have an exclusively qualified pediatric code blue team that is able to resuscitate our patients and collaborate with our hospitalists and staff all around the Children's Hospital to identify our children who are getting critically ill earlier and to improve their outcomes. And our national benchmark helps us build up a quality initiative, be transparent in our outcomes, and make improvement in our care. And we're always striving to establish quality initiatives to see how best we can improve care for our children.
And I know you're the PICU medical director, but we also have a level 4D NICU, neonatal intensive care unit. Can you share a little bit of information about what your colleagues in the NICU do, and maybe also the differences between what ages and types of patients would go to the PICU versus the NICU?
Absolutely. Our NICU offers the highest level of care for premature babies. They do have cooling protocols for their hypoxic ischemic encephalopathy infants. They offer high ventilator modalities. They offer jet ventilation. They also offer extracorporeal membrane oxygenation. And in fact, I collaborate with their neonatology intensive care director to run our ECMO program. So it's the highest level of care that they provide, and we are extremely proud to work with them.
I have myself muted. There is some concern about our ability to absorb some of the patients that may be affected by the closure of a general peds unit and I believe a 7-bed PICU. Is that something that you're concerned about in terms of that availability right now?
Yes, and first of all, I wanted to extend my gratitude and appreciation for the staff and physicians at St. John's for the work they have done to care for children in our community. But I want to reassure, especially with the concerns about closing of their pediatric units, but as a long-standing dedicated children's hospital here in Eastern Oklahoma, I would reassure everyone in the community that we are well established, we are well prepared to accommodate the patients and provide the highest level of care that we have always provided. And there should not be any concerns leading to the closure of the pediatric units at St. John's Hospital.
Thank you, Rupa.
Yeah.
I don't think I have any other questions for today, but if we do, I'll be sure to follow up with you.
Absolutely. Thank you.
Thank you.
Thanks.